Okay, good morning, good afternoon, good evening everyone, and welcome po sa ating 55th installment of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. We are glad that you can join us today as we continue on with our 5th season of our COVID-19 learning journey together. So for today po, we will be veering back to our special topic on COVID-19 vaccines. Iiwan po muna natin ng pansamantala ang ating virtual grand rounds, although we really appreciate that a lot of you were there and have really a familiarization na po on our virtual grand rounds. We will be revisiting that format later on in the next few weeks, but for today, we will be tackling a very, very important topic po. So even with vaccine supplies steadily arriving in the Philippines and the priority group categories already expanded to include A3 o yung pong mga taong may comorbidities, the percentage po ng mga nabakunahan na priority A2 group o yung pong ating mga senior citizens ay medyo may kababaan po. So para po sa araw na ito, we will try to understand not just the reasons for vaccine hesitancy among the senior citizens, but also what are the motivations for our senior citizens to finally take that plunge and take that jab into their arms. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. It's always a pleasure to be with all of you during our regular Friday lunch date. And as always, I look forward to our Fridays because I get to share hosting duties with my partner in crime and my mentor, who is a public health expert extraordinaire, also our adjunct faculty at the National Telehealth Center, and the special envoy of the President for Global Health Initiatives, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, good afternoon, Raymond. Magandang hapon po sa inyong lahat. We'd like to welcome everyone to the webinar. It's a Friday. Maganda po yung mga pag-uusapan natin. And we're just so grateful to welcome everyone from Davao, Zamboanga, Mindoro Oriental, Ilocos Norte, and all our Metro Manila hospitals who are here. We also have DepEd and the Philippine High School for the Arts from Laguna, daming taga Cavite. So magandang araw po sa inyong lahat. And sama-sama po tayo ngayon. Marami tayong maganda pag-uusapan. I'm sure everyone has a senior in the family, okay? Whether that's your parents or lolo at lola. Nakikita natin kasi kailangan importante pong mabakunahan sila dahil sila po yung may peligro talaga na magkaroon ng severe and moderate COVID. Pero mamaya makikinig tayo sa ating mga resource persons, our experts are going to tell us na mukhang konti lang ang nagpapabakuna sa mga seniors. Bakit ganon? Anong kailangan natin gawin? And kailangan tulong-tulong po tayo dahil napakahalagang maprotektahan natin ang ating mga seniors at maintindihan natin kung bakit hindi sila nagpapabakuna. So stay with us. We have a very exciting afternoon. Over to you, Raymond.
Thank you, Dr. Susie. So just so you know, we have really a spectacular lineup of speakers for today. It's not every day that we get a chance to have them on a webinar such as this topic. So we're very, very fortunate po. For those who are still trying to get in, please let us know if you are having any troubles. Well, we are seeing a little over 800 participants in the Zoom webinar po. But for those who are joining us sa ating Facebook pages ng TVUP, Stop COVID Deaths, UP System, also those watching us sa live streaming ng YouTube channel ng TVUP. Maraming salamat po. Please join us also kasi meron po tayong may very, very munting tweak sa ating mga pakulo every week. At sana po kahit po kayo ay wala sa Zoom webinar, watching outside of the Zoom webinar, we hope you will be able to still join us in our fun activities and fun polls po. So for today, we will try to, just try to imagine yourself if you could put yourselves in the shoes of yung inyong pinakamamahal na senior citizen. Ano po kaya ang mga tumatakbo sa kanilang mga isipan? Ano, bakit po sila confused? Or kung confused man po sila, ano po ba ang kanilang mga agam-agam patungkol sa COVID-19 na vaccination? For those who are joining us for the very first time, our speakers will be presenting po essentially theoretical and other important facts with regards to COVID-19 vaccination, followed by a set of reactions po from our esteemed set of panelists, and then panel discussion and Q&A session po before we move on to other questions. As always, especially for special topics, we will be choosing po 1 to 2 from our audience to ask their questions live dito po sa ating Zoom webinar. Dr. Susie?
Yeah, thank you very much, Raymond. So a couple of announcements. Hinihingi na ng mga hindi mga wala sa Zoom, they want the Mentimeter code. So can we kindly flash our Mentimeter link and the passcode? Okay, so we have, go to www.menti.com and use the code 1016488. 1016488. Now, what we're going to do is we will have the questions available to be answered on Mentimeter. But if you're on Zoom, you can also just click into the box that appears here on Zoom. Kasi napansin namin, baka yung mga iba nahihirapan pumasok sa Mentimeter. So we will use both of them, okay? So that's so that you can participate, and we have some very interesting questions for you. Now, we've got a special guest, and we would like to greet the former Secretary of Health. Okay, it's the birthday of former Secretary, Health Secretary Icona. At pinaunlakan niya.
Happy birthday, Sec Ona.
Pinaunlakan niya tayo.
Nako, thank you sa lahat. Thank you sa lahat.
Okay, so mamaya maririnig niyo si Sir Icona. Malalim pong mag-isip yan eh. Kaya sabi namin, kailangan natin maimbitahan si Secretary Icona dahil napakalalim niyang mag-isip ng mga bagay-bagay. Paano ba natin masolve itong mga seniors na hindi nagpapabakuna? So we will see more of Secretary Icona, but happy birthday to you. Okay, Raymond, over to you.
Thank you, Dr. Susie. Maligayang kaarawan din po ulit to Secretary Ona. But before we go into that, just to mention po and reiterate na dalawa po ang ating bubuksan for today, no? So for those who are in the Zoom webinar, we hope you'll be able to join us dun sa ating Zoom poll. But for those who are outside of the Zoom webinar, joining us in YouTube or Facebook or kung saan man po, please join us via the Mentimeter, www.menti.com. Ang code po ay 1016488 at nandun na po siya sa ating chat. We hope that will also be shared with those who are joining us outside of the Zoom webinar. Before we proceed, I'd like to take this opportunity to thank the hardworking team behind the Stop COVID Deaths webinar series. Maraming salamat po sa walang sawa at walang kapaguran po ng mga teammates po natin nasa production team for the webinar series. Without you, our webinar series will not be this successful, it will not even be possible. So maraming salamat po for making sure that this learning series is possible. We'd also like to take this opportunity to show ang ating certificate for this week. There we go. Ako pala ang taya this week. Webinar number 55. Help Ayaw Magpabakuna ni Lolo at Lola. Yan po ang itsura ng inyong certificate na matatanggap po, no? At least if you have spent 50% of the webinar duration with us, you'll be able to receive this along with a copy or copies po of the presentations of the speakers for today. So for those who are asking, we have already sent out the certificates for all 54 previous webinars. So please let us know if you still have any problems. As mentioned po, yung ating how you have entered your name in the registration link will be how it will be reflected in your certificate. So maraming salamat po. Dr. Susie?
Okay, so just to Sec Ana knows, there are lots of greetings for you in the chat box. Have a look, your friends are greeting you. Okay, so we are going to start today with a opening remarks by someone who is always on the webinar, but you don't always see her. She is the director of the Stop COVID Deaths webinar and is Professor Emeritus at the University of the Philippines for Film. So it is my distinct honor to welcome Dr. Grace or Gigi Javier Alfonso. Direk, welcome.
Oh, Maraming
Yes,
salamat.
direct.
Nasa ano ako, sa harapan ng camera, hindi ako used to doing that.
Pero yan po ang
Magandang hapon.
narinig ko sa mga dramatization natin. Kaya yung boses ng lalaki, ng babae, kaya niya ng baby,
Tama.
napakagaling Direct Gigi. We are just so fortunate to have her with us and to give us some sense of order. Otherwise, ang gulo-gulo nitong webinar. So, Direct, kayo ba yung nagbabakuna na?
Oo, nag-first shot na. Sabi
First
nga ni Doc Ted, ako daw huli, ay late. Pero meron tayong explanation that. Anyway, so,
Okay.
oo.
Go ahead and give us your, your
Okay, thank you. Magandang araw po sa inyong lahat. Thank you very much for this opportunity to speak to our community. I call our program Stop COVID Deaths as a community. We have bonded together. We've been together, tagal na, di ba? For more than a year. You have shown trust in our program. So we come every Friday doing our share and claiming our space to help minimize fake news on the COVID-19 pandemic. We've had mga 300 guests, top experts, our presenters, our discussants, our presenting all the research, data, our reactors with their talagang valuable insights, all presented with passion and resolve in sharing new knowledge. In the way they answer the questions, we feel the truthfulness, the authenticity, and the transparency. Kaya nandun po yung trust, yung mga questions and answers, ang mga questions natin, kayo ho, nanggaling sa inyo. Many of our selected topics were inspired by your comments and questions. Ang mga participants natin dito, mga medical practitioners, kayo po yung nasa front lines, policymakers, hospital administrators. Kasama din po natin dito yung mga na-interview natin sa persons on the street. Sila po yung nanonood, kasama nila ang kanilang mga kamag-anak. We can see from them how their decision-making process are highly becoming based on science and facts, pero merging with socio-cultural aspects as well. At this point, gusto ko pong batiin at magpapasalamat sa ating mga speakers today. Dr. Ted Herbosa, isang haligi ng ating programa, Special Advisor, National Task Force Against COVID-19. At meron din po siyang programa sa TVUP, ang tawag natin doon sa programa niya, Health Issues. And also, we're fortunate, nandito sa atin si Dr. Shelley De Las Llagas, Director ng Institute on Aging. Ikatatlong suki din po sa atin yan. Institute on Aging, National Institute of Health ng UP Manila. Si Doc Ona, Dr. Enrique Ona Jr. Alam ko kilala niyo sila. Siya, former Secretary of the Department of Health. Si Dr. Lilian De Las Llagas, CHED Commissioner, Public Health Practitioner, at may programa rin sa TVUP, Kalusugan ay Karapatan. And thank you very much for being here at Dr. Charlotte Chiong, our beloved Dean of UP College of Medicine. Hi, Dean. In your closing remarks, inaabangan namin ang magiging synthesis mo. So magandang hapon sa inyong lahat. As a communication person, I will give you an idea of the kind of dedication we put in your program. At the start of the week, we meet. Ating mga host, si Dr. Susie, si Dr. Raymond, yan ang siyang core ng conceptualization ng bawat webinar. Si Chancellor Menchit, si Dean Charlotte, si VP Neni, si AVP Rica, si Dr. Ted, si Dr. Stella. Planning po yan for the webinars to come. Sino ang mga guests and topics needed to be addressed? Then we review the past week's webinar. We go through all your comments, and then we dedicate another day for shoot of persons on the street, capture the beat of the people, how they think, and they're making sense of the things happening in our lives. Or we create a dramatization. of our ground rounds cases. And then next day, do editing. Then Friday comes, we open at 9, technical rehearsals. Then we go broadcast 12 o'clock, 12 noon. So let us not underestimate the capacity of our community in making a difference. We reach almost what? Pag ano, 1,000, 2,000, sometimes we go 3,000 full capacity, counting the people who are in YouTube, Facebook, may additional thousands po yan. So around 6 to 14,000 every Friday. At pag minultiply mo yan, sharing the lessons learned dito, you share it with your families, relatives, friends, at kasama sa trabaho. At balita ko po, marami pong mga viewing sessions sa ospital and health centers during lunch break and every Friday. At pag sinama-sama mo, di ba, sumasagot kayo sa mga tanong ng mga nagtatanong sa inyo araw-araw. Thousands and thousands are networked together by our program. That's, we feel the culture of sharing, the synergy of this regular learning experience happening at the same time, watching it on the replay, padagdag po ng padagdag yan. Exponential growth at all times and all places. Our webinars are accessible 24/7 in TVUP. Ito pong ating programa ay buhay at buhay mga kwento ng COVID-19 sa ating bansa. Oral history po. Teksto po ito, data for researchers, gamitin nyo for your e-journal publications, your journal publications, gamitin din course materials sa klase. When you think about it, our community is an agency for change to bring us to that goal of having that herd immunity. That is so much needed. Kahit sabay-sabay po natin yan, ang mga senior citizens natin na magpabakuna na yan. Yan po ang pag-uusapan natin ngayon. Kaya ang title natin, Help! Ayaw magpabakuna ni Lolo at Lola. Talaga bang ayaw nila magpabakuna o hindi lang nila magawa o walang tumutulong sa kanila o kulang ang information o nakakagulo sa dami ng nababasa nila at nadidinig nila? I am really looking forward to learn from our experts today why there is a low turnout of seniors being vaccinated. At gusto kong sabihin sa lahat, ang pagsusuri at pagpabantay sa kalusugan ng ating bayan, yan po ang ating ginagawa sa ating programa. Kaya't maraming salamat po for being with us every Friday. This program is yours and thank you very much for making it happen. Back to our well-loved hosts, Dr. Susie and Dr. Raymond.
Thank you very much. That's Director Gigi Alfonso, who really is, what should I say? She works wonders with our program, and it's great to have her on cam. Ma'am Gigi, please stay for the panel. I hope you'll be able to.
Thank you, Direk.
Yes, I will. Thank you.
Yeah, great. So, para meron tayong maganda tayong kwentuhan mamaya. So, Raymond, over to you. I think we're going to do our questions, no? Opinion
Okay,
poll.
yes po. Opo. Medyo nagulat lang ako sa message ni Direk, pero we don't have often to get to hear her say those things, but maraming salamat po for the compliments, and it really is a testament po for on all the teamwork and for your leadership po, Direk. Maraming salamat. So for those who are in the Zoom webinar, ulitin ko lang po, no, nakikita nyo rin po itong mga same questions na ito sa Mentimeter. When you go to www.menti.com and enter 1016488 as the code, ito rin po yung mga tanong. Wala pong pagkakaiba ang mga tanong po na nandito sa Zoom webinar. Doon po sa Mentimeter. We have actually just a couple of questions here. The first question would be, do you have a senior citizen relative who refuses to be vaccinated? Meron po ba kayong kamag-anak na senior citizen na ayaw magpabakuna? Medyo neck and neck po siya, no? Talagang very timely ang ating topic. 57% say yes, 43%, 44% say no. So malaki po ang porsyento ng mga nagsasabing may mga senior citizen sila na kamag-anak na ayaw magpabakuna. Number 2, Sa inyo pong opinion, ano po ang mga common reasons, makaraniwang mga dahilan why they do not want to be vaccinated? Kung bakit ayaw po nilang magpabakuna? Ang top choice po ng karamihan, takot po sila sa side effects and complications. So karamihan po ay sumagot po noon. Although for this question, pwede po kayo pumili ng more than one answer po dito. I think ang pinaka-konti po is ito pong mobility issues or bedridden and afraid of the needle. Next to afraid of side effects and complications, ang next pong pinaka marami ay they do not trust. Ito po, may vaccine trust po. They do not trust the experimental vaccine. Yun po ang napili po nila. Ang kasunod po dito ay yung they want to watch and wait, and also they are afraid of getting COVID at the vaccination site. So meron po palang ganoong agam-agam na baka makakuha po sila ng COVID sa vaccination site. Medyo maliit lang po ang porsyento, although very, very important to note na mga 14% ang nagsasabing hindi po ito kasi conveniente. Medyo malayo, wala akong transportation, sasakyan, wala akong kasama, etc. So nandun po lahat ng inyong mga rason. Okay, so for those who are joining us po, participating dito po sa poll, sa Mentimeter, we are also able to see your answers po, no? Okay, there we go. Although marami rin pong sumagot sa Mentimeter. Hopefully, yung pong mga sumagot po dito po sa poll ay hindi po sumagot sa Menti dahil dodoble po ang ating mga kasagutan. For question number 2, pinakamarami po, ganun pa rin po. They are afraid of the side effects and the complications. Maybe our main speaker will be able to talk about that. She is a member of the Interim National Immunization Technical Advisory Group for COVID-19 vaccines. But before we go to her, I'll take this opportunity to greet our attendees from the Limay Emergency Health Center in Limay, Bataan, Central Luzon, Batangas Medical Center in Batangas City, Calabarzon, Visayas State University in Baybay City in Leyte, Eastern Visayas. Ingat po kayo lalo po sa panahon ng bagyo. Visayas State University is followed by Provincial Government of Lanao del Sur in Marawi City in Bangsamoro Autonomous Region in Muslim Mindanao. We also have those from Pilar College of Zamboanga City in the Zamboanga Peninsula. Internationally, we have our regular from Bangkok, Thailand, from Ho Chi Minh, Vietnam, Cebu, Malaysia, North Delhi, India, Riyadh, Saudi Arabia, Dubai, United Arab Emirates, Karak, Kuwait, Sicily, Pordenone, Italy, and our regular from the Niagara Falls, Ontario, Canada. So please continue to input your answers as we go into the main event. Dr. Susie, will you do the honors po? You're on mute, ma'am.
Yeah, thank you very much, Raymond. And it's good to see everyone participating in our opinion poll. Wala pong, well, I don't know kung may tama't maling sagot doon, malalaman natin mamaya. So ngayon po, TVUP po ay gumagawa ng tinatawag natin person on the street. We talk to interview people who are not with us and get their opinions. So I would like to ask TVUP to please play our person on the street video.
Actually, I wasn't hesitant kasi in fact, I'm one of those who are campaigning para sa vaccination ng mga senior citizens. So as far as I'm concerned, napakahalaga po na ang mga senior citizens ay mabakunahan. That doesn't only protect them individually, kundi it protects the entire family.
I was hesitant because of my aneurysm. So natatakot ako. They were saying na okay naman, pwedeng nonetheless, no? I could still be vaccinated. My aneurysm will not in any way kill me. So I asked also my friends, mga doktor sa eskwelahan ko, the medical director, okay naman daw, pwede naman daw.
Kasi ganyan nung una din, siyempre may doubt, no? Kasi hindi natin alam, bagong bakuna yan. Ano ang magiging side effects niyan at saka effective ba siya talaga? Pero ngayon nakikita natin na very minimal naman yung side effects.
Simula kasi nung nagka-COVID, nanghina na talaga yung mother ko. Before, nakakapagsimba, nakakadayo ng kapitbahay. Pero simula noon, nung yun nga, nagka-lockdown, nanghina na siya, nag-deteriorate na yung health niya. Then finally, nung dumating na yung bakuna, first, siguro hesitant ako kasi nga, bedridden na yung mother ko. Andun pa rin yung hesitancy, pero willing kami magkakapatid na magpabakuna na sa kanya.
And many of our employees nadali ng COVID-19, dalawang doktor ang namatay because of COVID. So dahil they were affected by it sa hospital. Dahil natakot ako na maraming na COVID, I finally said, sige na nga, magpa-inject na lang ako.
Specifically for senior citizens, we know that it's really very important for seniors to get vaccinated. So yes, there was definitely hesitation, fear of side effects of the vaccination primarily. And we had to really, explain to them and educate them on the importance of the vaccination.
It's not really vaccine hesitation, no? Actually, a bigger percentage of my elderly patients are not hesitant to get the vaccine. In fact, they are very familiar with vaccines because they are also the population group wherein we advocate the pneumococcal and the influenza vaccine regularly. So they are used to getting vaccinated. Number one that I've seen so far amongst my patients is registration. No? There are some municipalities like Quezon City, Pasig, where the registration is online. No? It requires a device, it requires internet connection, and it requires a little bit of tech savvy in order to be able to register.
Quezon City government, actually, there are two ways to sign up for vaccination. There's barangay assisted, which is scheduled. The barangays, Quezon City barangays, are given a specific schedule and slots. And there's also Easy Consult, which you can book online. Obviously, for some seniors, meron silang challenge yung mga doing it online. So we had to assist them talaga. Some, we actually had to make emails for them or make the actual account, yung Easy Consult account po, and then assist them in bookings just to be able to get them vaccinated po right away.
And then, of course, there are those elderlies who don't have the capacity to leave the house. So those are my post-stroke patients. Those are my patients with dementia who are very difficult to remove or to take out of the house in order for them to get vaccinated. So, problem din yun. Kasi I have patients who are in their 90s or in their 100s. No? I have patients 100, 200, 4, na it's really very difficult and very challenging to get them out of the house.
Yung schedule namin was 12 o'clock. So we were there at exactly 12 o'clock. Nang dumating po kami, punong-puno na ng tao. Walang problema sa distancing. Kasi nakaano naman po yung mga upuan. But sa dami ng mga tao at saka sa init na yon, doon kami nababad ng husto sa init. Isipin nyo from 12 o'clock, naturukan kami magpa 5 o'clock.
Sana proactive sila. Saka hindi sila namimili ng asikasuhin.
For some po who still had some challenges, we offered yung drive-through so that they didn't need to go down to their cars. And then also, Quezon City government offered home vaccination, home visit for those na bedridden and then or like talagang major mobility issues.
Meron kaming isang kagawad na in charge of seniors. ginagawa nilang madali para sa mga seniors na magpabakuna. Kung hindi ka marunong pumunta doon sa e-consult, tuturuan kanila at saka talagang gagabayan kanila hanggang doon sa vaccination hanggang doon. Talagang napakalaki po ng tulong ng aming barangay. Tapos ngayon po, yung Quezon City, isa din talaga siya sa pinaka-organized na LGU at mabilis.
It's also the little things like information dissemination. How do people know? How do the senior citizens know how to register?
For those who have not been vaccinated, to submit to vaccination kasi napakahalaga ng protection. Yeah, I don't even advocate on the use of a certain brand kasi as far as I'm concerned, lahat ng brands na ito would be helpful kapag ito ay inavail natin.
Thank you very much, TVUP. Very insightful to hear different views on why the seniors are having difficulty getting vaccinated. And we'll continue this discussion. Right now, I'm very pleased to introduce our first presenter. And he's not new, you know him. He's one of the founders of Stop COVID Deaths. He is a trauma surgeon, world-class expert in emergency response and in disasters. And our country is very fortunate that he is special advisor to the National Task Force Against COVID-19. Hindi niya tayo iniiwanan at mabuti naman kasi kailangan natin malaman anong nangyayari. We'd like to welcome Dr. Ted Herbosa. Ted, welcome to the webinar.
Thank you, Susie, and good afternoon to everyone. I'm so happy that a lot of our colleagues in the senior citizen category, including myself, are here to discuss this very important topic.
Ted, go ahead with your presentation.
Okay, thank you. Let me share my screen. Well, allow me to give you a brief overview of what's happening on COVID-19 with a specific focus on the vaccine deployment and also our age group, the A2 category or the senior citizen priority group. We've gotten into this complex situation we in disaster medicine call a complex emergency, something that is a major humanitarian crisis that is often the result of a combination of political instability, conflict and violence, social inequity, and underlying poverty. We usually use examples of war for complex emergency, but now I'm seeing that a pandemic that has caused this great effect on the social and economic sectors of society is indeed an as well complex emergency. So this is the global picture right now. The size of the red dots on the global map of WHO show the size and numbers of COVID-19 cases there. And if you look at the per capita by population per 1 million, you will see that the countries seem to be different. Although the countries that we see always listed are different in terms of total numbers, but if you do that per 1 million population, you will see a change in how we look at things. So it's all a matter of looking at the correct picture. This is a busy slide, but it's the National Action Plan against COVID-19. We're actually on phase 3. Phase 1 was really building up capacity and learning about COVID-19 with testing molecular laboratories. Phase 2 was actually deploying the PDITR strategy to the LGU so that they can implement it well in the cases that happened. And phase 3 was really all about balancing economics and control of the pandemic together with the third cluster we call the vaccine cluster. This is the latest. Just yesterday, the Department of Health reported again an increase of cases. We were already at the low 5,000 new cases. It's back to 7,217. And for the first time, the other regions, Visayas and Mindanao, outnumber the cases in NCR plus or the NCR bubble. So we are controlling the situation in Metro Manila, but we have outbreaks happening in Iloilo, Bacolod, Cagayan de Oro, Zamboanga, Palawan, General Santos, Surigao. So that is our situation. And in terms of the other table here on the right side is really the biosurveillance of what variants are the predominant ones. We continue to have the predominance of the B1.357. I think they changed the nomenclature again. They now change it to something I forgot, but WHO changed nomenclature again. So this is the South African variant, which is the most predominant, followed very closely by the UK variant, and the P3, which is the Philippine variant found in Region 7. We've had cases of the B1.6.17, which is the Indian variant, but among travelers, they were quarantined and they have not actually infected anyone in the community. So there's no community transmission. So these are the NCR cases. It's actually decreasing, but it plateaued and slowed down. I think the other super spreader events a couple of weeks back are now contributing to the increase or to the plateau or the decline in the slowing down of the cases in NCR. So we need to keep our guards up. We should not let it down. This is our hospital care utilization rate at NCR. At the peak, you will see that we were at 88% of the ICU beds. This was the time when people couldn't get admitted in the ICU beds and were dying in tents outside the ER, or worse, in the car or in the ambulance. And as of May 31, the president announced our classification. Actually, what is interesting here is not that the NCR plus bubble was decreased from GCQ with heightened restrictions to GCQ with restrictions. So that's just a little terminology. But what is more interesting is that there were 14 areas which was heightened up from GCQ and converted to modified enhanced community quarantine. Therefore, a stricter community quarantine. Santiago in Cagayan, Apayao in Benguet, Ifugao, Puerto Princesa, Iloilo, Zamboanga, the whole Zamboanga Peninsula, Cagayan de Oro, Butuan, and Agusan. Then the rest of the Philippines are now in modified. So these are just the differences. I will not belabor anymore. What are the differences between GCQ and GCQ with restrictions? So over in the last column are all the GCQ with restrictions. It's about the numbers and percentages of what can and can't be done in these different activities. As for our vaccine program, we have a goal to and a roadmap that was planned way back in October of last year. And the idea was to save more lives, recover our economy, fully integrate vaccine deployment and the immunization program against COVID-19 with a whole of nation or whole of society approach, and the goal of reducing morbidity and mortality that is due to COVID-19. So more interestingly, there are three imperatives now to end this global pandemic from the Philippine perspective. The first is really to strengthen surveillance and sustain mitigation, testing, tracing, and isolating at scale. So we have to do this now in Visayas and Mindanao and Northern Luzon. Border control and biosurveillance through genomics of the different variants that are coming up. And sustain public health measures. Now there's discussion about removing the face mask and leaving just the removing the face shield and just leaving the face mask. So these arguments will continue. These debates will continue as we go on with vaccination. But the second part is really to aggressively vaccinate. Aggressive is the key word here. We have supply and redistribution as we expand and we create more supply. The problem is demand generation. We need to increase demand generation. There are sectors that are good. Suddenly, everybody had a comorbidity when A3 was already being injected. So everyone who looked healthy suddenly had a certificate of an associated comorbidity. Then we have to continue our adverse event monitoring. And we need to look future in the next year, the possibility of a second generation of vaccines or booster doses for those that have already received the complete 2 doses of the different vaccines. We also have to look and study now targeting by 2022 pediatric or 12 to 18 years old, 12 to 17 years old, which are not yet covered in our current one. And another interesting study is the mix and match of vaccines. I just got a text from someone who wants to get Moderna after getting 2 doses of Sinovac. So is that possible? So we are still awaiting the verdict on all those decisions. The private sector has been very helpful, and I'm happy to announce that this coming June, the AstraZeneca ordered through a tripartite agreement are coming. So is the Moderna ordered by through a tripartite agreement ordered by the Razon Group are also arriving in June. So we will be having several supplies aside from the regular Sinovac that's arriving, and of course the COVAX, AstraZeneca, and Pfizer doses that are arriving, including some extra doses from the United States, who have promised to give us some of their Pfizer doses. Very important really in the vaccination is the vaccination program, and central to this is actually communications. We have realized that the campaign will entail a big amount of collaboration. And yesterday you heard the new campaign, which is the Bakuna Benefits campaign, which is over 1,000 restaurants are now giving benefits and discounts, 5% discount on purchases if you show your vaccination card. So people with full vaccinations get the 5%. And I think on Monday, some gas stations will give as much as 3 pesos per liter discount for those who can show a vaccination card. So this is the Bakuna Benefits Consumer Incentive Activation, and it is really a way to incentivize people. Other countries like the US is implementing a raffle and lottery. Ours has been approved as well. The DOH presented it, and I think it's the PCSO that will be implementing some kind of lottery for our vaccinees to increase inclusion. So this is the big problem. We have a lot of people who said in the poll that they're afraid of the side effects. And most of the side effects have come around because of fake news of what's going to happen to your DNA, what's going to happen to the vaccines because they're experimental, inclusion of microchips. A lot of fake news going around, and people are sharing and resharing them. So that's the big problem. When it is reshared, they say when you tell a lie and you tell it often enough, it sounds like it's the truth. So this is the struggle we fight to counter fake news, disinformation, misinformation. The private sector will be injecting with their own vaccination sites and will be increasing our vaccination output or throughput daily to reach our targets. As much as 93,000 jobs for the first 30 days are promised by the private sector. They've also used very important sites like the mall. This is in SM Aura in Taguig City, and they've used the events place called the Samsung Hall for a very convenient vaccination site. And I saw that many of the seniors were very happy with it because it's air conditioned, there's an elevator, it's easy to park. They've also developed a bus vaccination that will go to the poorer areas of Taguig, so it can go barangay by barangay and vaccinate the priority groups. So we have several, about 8 million that arrived already as of May, and by June 6, another 1 million doses of Sinovac is due to arrive, plus many more that are arriving this month. A total of 9 million doses, almost 10 million doses, are due to arrive June. So this is the distribution of that. We've actually received 8,329,050 doses of different types of vaccine. We have 4 brands: Sinovac, Sputnik, AstraZeneca, and the Pfizer that have arrived. By June, we will have 5 brands. We will have Sinovac, Pfizer, Moderna will be added to the list. So we now have 5 of the 7 that we have committed, and we expect to get almost 10 million, 9,950,000 doses to arrive in June, and that will bring us up to a total of 18 million doses arrived already in the Philippines. In the beginning, we were focusing on our NCR plus 6 provinces for the focus because that was where the cases were very high. Now that it is decreasing, we have the different regions asking for more, like Region 8, Region 7, Zamboanga. So these people are all asking for more vaccines so that they can fight the outbreaks that are currently happening in their area. So 70% of the population is about of the 83 that's about the target. So that's 58 million. So this is how we plan to deploy our targets. If we reach up to 50%, and this has been seen in the other countries, if you reach 50% of your population vaccinated, you will achieve containment. Containment means you will reduce hospitalization, fatality, and deaths. And this includes the A1, which is the healthcare workers, the A2, which is our senior citizens, which is our topic for this afternoon, and A3, the persons with morbidities. These are our most high-risk population. And if you want to make a dent in our case fatality rate, these people must all be vaccinated by September. And if we continue from September onwards to November, we can actually have more of the prevention of continued transmission and be able to contain the disease. But I think it will take another year, maybe in 2022 or even 2023, when we can finally eliminate the disease and hopefully even eradicate it with just very good vaccination. So I think these are the vaccination statistics. These are the total doses, 5 million doses that have been given, 3.9 million as the first dose, and 1.2 million as the second dose. It's very difficult because of our limited supply, we have asked some second doses to be given as first doses because we expect more of the Sinovac to arrive on June 6. So medyo erroneous yung someone claiming na 1 million second doses are missing. In fact, the difference also is in the 500,000 AstraZeneca that we vaccinated initially, 525,600, which were vaccinated in mid-April, are due for vaccination with their second dose with Astra this week, actually last week and this week. So that will kick up with another 500 people getting their 500,000 getting their second dose, because that is really the duration of the interval, 84 days. So it's a difference of 21 days, the shortest, which is your Pfizer, your Gamaleya and Pfizer, and your 28 days, your Sinovac, and 84 days interval, which is your AstraZeneca. So you've seen this graph shown on television showing that we've reached the peak average of 150,000 vaccinees per day. That's a very good speed of vaccinating people. So we're high up there, above Thailand, above Indonesia, above Myanmar in terms of vaccinations per day. In fact, we even reached a high of, in late May, we reached a high of 230,000 doses per day. We have cities like Quezon City and Manila that are vaccinating almost 20,000 vaccinees per day. And this is the story of where we are right now. For the administered doses on a 7-day accomplishment rate, so we're averaging 1.1 million per week in the past 2 weeks already. So 1.1 million doses per week. We want to raise that to about 1.5 million per week. And you can see that our senior citizens are A2. We've vaccinated about 90% of our master listed A1. So I guess the ones that are waiting are either because there is a problem or because they're waiting for a vaccine that they like. So the health workers are given choice of what they want. But the senior citizens have a very low percentage. And let me just show the figures of that. This was the difference, no? In 2 days, you'll see the number of doses per day. In May 29, we reached up to 198,984. So as long as there are supplies, we will be able to deliver. So the second week, we got 169,709 7-day average of daily vaccinations, about 61,000 senior citizens or 12,000 with their second dose. So this is May 30. You will see we increased again the number of doses being delivered because of the increase in our pace. In fact, we have local chief executives complaining that they are already lacking the supplies to vaccinate because the supplies are getting scarce at the end of May, and we're waiting our deliveries. So these are some of the master listed computations of how many people really above 60 years old are in our population. So you can see here that in 2019, we had 9 million people above 60. So there are people that die, but there are people who become 60 also. So I assume it's stable at about 9 or 10 million people are in the senior citizen category. And that's about 8.6% of the population. And women aged above 60 is about 4.83%. So there are more senior citizens who are women, and our current average expectancy is 67. So this gives us an idea of how we are deploying the vaccines. In the first quarter, we just had A1. By the second quarter, we added A2 and A3, the senior citizens and the people with comorbidity. And these are the individuals that have been vaccinated. No, 1.4 million health workers, 1.3 million senior citizen, and 1.1 million A3. So yung A2, nakita nyo kanina, 9 million, 9.8 million, almost 10 million. So we're at only 1.3% of them that have been vaccinated. And of our target 70 million, only 1.2 have been fully vaccinated. So we're doing it fast, but we're still a long way to go because we're just starting our journey to vaccinate these people. So let's go have a dive into the A2 priority group as of May 30, 6 p.m. You will see that our overall completed first dose is 29%, and our overall completed second dose is 10%. And this is the overall, we are at 17%. So medyo mababa yan considering that we have started vaccinating since the first, second, and now it's going to be the third quarter. So for 2 quarters, the A2 priority has been there. And yung A1, nakuha nating 90%. Yung A3, interestingly, ang dami nila. They got certificates for more comorbidity, so they outnumber the A2. So why are our seniors not going to our vaccination sites? When it's free, it's available. So ito yung coverage ng A2, no? The coverage of the vaccinated with the first dose and the second dose. So of the A2 vaccinated for the Philippines, it's 17%. For NCR, it's a bit high, 29%. Pero when you go to the other regions, we have areas like Mimaropa that is only 7.2%. So mababa yung mga senior citizen natin in the region. So we need to solve this problem. So but if you look at the A3 started to increase. We have vaccinated so much more, 1.6. Master listed is 1.6, and now we have 1.1 million. So I guess dumami lahat. Even all the celebrities now have comorbidities. So it's very interesting how people are motivated at certain age group levels while others are not. Even the A4, which is starting on Monday, nagko-complain sila kasi by age, we started with 40 to 50 years old. Nagko-complain yung younger. So it's a nice problem to have. So if you take note of the vaccinations of A2 and A3, for all regions are lacking in vaccine supply. There is no slowing of demand from the priority group. The vaccination activities are limited due to the lack of supplies to the regions. However, NCR, Region 3, Region 4A are vaccinating more of priority A3 than the A2. Ibig sabihin nun, dito sa NCR and the Region 3 and Region 4, yung ating NCR+, mas maraming A3. So these are younger individuals. So nakakaligtaan natin yung ating senior citizen. So these are for the 4 doses. The blue one is the cumulative for healthcare workers. Kita mo, ganda talaga ng graph natin. Yung yellow is for the A3 and the red is the A2. So nakita mo, mas mataas yung pag-peak ng A3 na gustong magpabakuna. So these are just some pictures of us. It's always very emotional for me when I get to see the vaccines arriving, being delivered from the airplane, because I count 1 million doses. I said that's 500,000 Filipinos again going to be saved from COVID-19. Of course, COVAX brought the Pfizer, and hopefully we can get more of that popular brand. And this is Sputnik V. You can see the sign of Sputnik V. So as a summary of what's happening, there are good news and bad news. And of course, as a very optimistic person, I will say the good news. We have breached the 5 million mark on vaccine administration. The Philippines has now achieved the highest rate and tempo or speed on vaccine administration in the ASEAN region. Tayo po ang pinakamabilis. Yung nagawa natin in 3 months, since December pa ginagawa ng Singapore. So mas mabilis, mas madami tayong nabakunahan in a shorter period of time than what Singapore was able to do. And hopefully with a steady supply of all the different vaccines through our approach, which is, I think is working, the portfolio approach. Thailand only ordered from 2 companies, so did Malaysia. So nagkaka-problem sila ngayon sa supply. But we ordered from 7 companies and we now have 4 brands with an additional 5th one. Then we're due to get 80 million doses from the US State Department. Basta daw pirmahan natin yung BFA. No, cancel. No, I think that's part of the interest in the Philippines as an ally. Tayo daw ay long-time ally nila, so they want to share their excess 80 million doses that they hoarded last year and none of the other countries could get. Then, of course, more LGUs are scaling up their capacities. Some LGUs are now having house-to-house. Yung problem kanina, they send out their people with a laptop or a phone, and then they register the senior citizen in the home. They help them run through the registration. There are those that provide free transport, and there are those planning to do house-to-house for the bedridden senior citizens. The business sector has already committed. You've seen the one I presented, the Bakuna benefits, and that to increase our output and increase our vaccine trust. And the Philippines is rated number 1 in the global COVID-19 on international budget partnerships result on the global scorecard for accountability. With that, I'd like to thank you all. We remember that all must be vaccinated, including our senior citizens. We are not safe until everyone is safe. And walang maiiwan, walang iwanan. Thank you very much. Back to you, Susie and Raymond.
Okay, thank you very much. That's Dr. Ted Herbosa, who is the Special Advisor of the National Task Force Against COVID-19 and faculty of the University of the Philippines, Philippine General Hospital. Raymond, over to you.
Thank you for giving us a glimpse po of the statistics, Sir Ted. We move on po to really one of the pillars in the geriatric community po, geriatric medicine community, sorry. She is the director of the Institute of Aging, the National Institutes of Health, and she's director Shelley Ann Vega po. Sorry, kulang.
Okay, Raymond, I am not yet a senior citizen, but I love working with and for senior citizens. So allow me please to share my screen. Okay na?
Okay po, we can see it, ma'am.
All right. Thank you very much. I'm Shelley De La Vega, Director of the Institute on Aging of the NIH, UP Manila. And I'm going to talk about hindi pa nababakunahan ang senior citizens. Bakit? No? So these are my disclosures. I'm a member of the interim NITAG for COVID vaccination, and I was president of the Philippine College of Geriatric Medicine and the Philippine Foundation for Vaccination. So these are the objectives of my talk. First of all, we are going to just discuss very briefly, because this is my 3rd guesting, and I think you can look at previous episodes for the more detailed discussion on why there is a benefit to vaccination of senior citizens. So why do senior citizens need the vaccine? So risk and benefit. And I'm going to talk to you a little bit about the concept of healthy aging. And then we will describe the challenges to COVID vaccination. We had several fora, key informant interviews, and roundtable discussions, and I will share the results with you. And of course, if you recall, one of our geriatricians who spoke earlier said, marunong na magpabakuna ang mga senior citizen kasi sanay na sila magpa-flu and pneumonia vaccine. Pero meron din balakid dun sa maliit na programa na yon, which I think is also affecting the COVID vaccination among seniors now. And then, of course, we will look at the current situation of the COVID vaccine rollout. Thank you, Dr. Ted Herbosa, for talking about it in greater detail. And then I am going to propose solutions based on our RTD discussions and fora. So let's start now. So this is where our senior citizens are. This was the 2015 Census of Population and Housing. And if you recall, Dr. Ted Herbosa flashed a more recent statistic saying that more than 8% of our population is now aged 60 years and older. And more than 8 million are already senior citizens as we define it to be, 60 years and older. So these are where they are, sabi nga ni Dr. Ted Herbosa, konti lang sa Mimaropa ang nagpabakuna. Kasi siguro yun lang isa sa pinakakonting senior citizen sa buong Pilipinas. So let's look at the distribution. Where are they? These are the top 5 regions with the highest number of senior citizens. So the highest number are in Region 4A, Calabarzon, followed by Region 3, NCR, and then number 4 is Region 6, and number 5 is Region 7. Now for the Mindanao area, Davao has the most number of senior citizens. So senior citizens are at risk of severe COVID. We know that. Internationally, we know that the risk increases from age 50 hanggang 1.3% lang. Pero once they're seniors, nagiging 3%. So there's a tripling of the number of deaths. And for those aged 80 plus years, up to 20% have died of COVID among our seniors. In the Philippines, the death per 10,000 population also increases as age increases. Below age 50, the death rate per 10,000 is only 4.32, but once they reach the age of 65 and older, it's already 81.15. So ang laki-laki ng number affected and deaths, especially among senior citizens. The older they are, the higher the risk of severe COVID and death. Now, why are our senior citizens at risk? It's because they have what we call comorbidities. So in one of our studies called Fit for Frail, the comorbidities among Filipino older persons that we identified that are related to COVID risks are hypertension, diabetes, obesity, tobacco smoking. So madami yan, and many are men, by the way. And we know that for COVID deaths, there are many men who die, And aside from that, many are living alone and cannot be reached. So maybe this is one of the factors that we need to consider when we are looking for the senior citizen that has to be vaccinated. And of course, the dependency is about 15.6%. And these are probably also the more frail, yung mahirap makapunta sa mga vaccination centers. So let's remember these numbers. We now know that there is also long COVID. Ano ba yon? Long COVID is when the symptoms persist beyond the maybe 1 month from hospitalization. These symptoms persist to beyond 6 months. Sometimes more than a year na tayo may COVID, so more than a year. And the symptoms can be psychological and physical. So psychological symptoms are, of course, grief and bereavement, especially if someone else in the family dies from COVID. Post-traumatic stress disorder. A lot of those who suffer from COVID have anxiety attacks. Naiisip nila yung when they were in the hospital, when they couldn't breathe, or when they really had to be brought to the ICU, Insomnia or poor sleep, poor memory, or brain fog, I see a lot of my patients now having these symptoms, brain fog especially, and some measure of depression. Physical, long COVID symptoms include persistent shortness of breath, fatigue, joint pains, and poor mobility, poor appetite, hindi makakain kahit matagal nang gumaling sa COVID, headache or pains anywhere, So let's remember this. These long COVID symptoms are very important to older people because sometimes when you're already very old, you no longer think of yourself as having to live long, or you know that you may not live long. So the remaining years that you have, you want to spend happily, with great well-being, and with people that you care most about. And this is what COVID takes away from those number of years that you have remaining in your life. So are senior citizens too frail or too weak for COVID vaccination? Ito yung lagi nating naririnig, masyado ng maraming sakit. Hindi ko na pababakunahan si nanay. Or one of our speakers earlier said, meron akong aneurysm, baka magkakomplikasyon ako sa COVID. In fact, yes, frailty is a condition among the oldest, especially the oldest old. And when you are frail, you have reduced strength and physiological malfunctioning, and that may predispose you to dependency, vulnerability, and death, especially from COVID, no? But when we did a study, as I said, Fit for Frail, only 15% of our participants were frail. And most were not frail. So the Filipino citizens that we looked at were mostly robust or pre-frail. Ano ba yung pre-frail, no? If we look at robust, pre-frail, and frail as a continuum, this is something like, you have to think of it as something that is reversible. So a frail person, as long as they get proper management, as long as they have a good supportive system, can become pre-frail. A pre-frail can become robust. So very important to know that a supportive system can reverse all of the frailties that we know about, no? So here comes senior citizen vaccination. We know that senior citizen vaccination reduces the risk of death and complications, including long COVID. And those of you who continue to work, I know that there are senior citizens age 70 who continue to work, no? You may continue to work once you are vaccinated. It also protects those around you, your family members, the people you work with, the people in your church. And it enables you to attain healthy aging. And what is healthy aging? This is very important to senior citizens, like I said, because it allows you now, if you are vaccinated, it allows you to function in areas of your life that are most meaningful to you, no? Especially spending time with family, no? And making up for lost time with maybe people that you have not been in contact with for a long time. Even working, that can be meaningful. And it helps you attain well-being because you don't want to have those long COVID symptoms. Okay, so what is healthy aging? Just briefly, healthy aging is that process of developing and maintaining functional ability that enables your well-being as you age. And if you have a supportive environment, if you have a health system that allows that, then you will function best. No? So this is how we look at it. Look at that red line here. Functioning decreases with age, with biological aging. This is intrinsic to us. Nagkakasakit po tayo. Meron tayong mga napagdaanan sa buhay. Nagka-COVID pa. Ayan, no? That red arrow there will really reduce your functioning drastically, no, once you have COVID. So this is just one example. But some people, if you look at the blue line, are able to maintain their function well enough, even as they age. And this is where vaccination comes in, because COVID-19 vaccination is a health system intervention, no, and that supports an older person and that allows him or her to function better than others who did not receive the vaccine. So that is what the vaccine does to functional ability. All right, so therefore, senior citizens are the best candidates for COVID vaccination, especially and even if they have hypertension, diabetes, heart disease, kidney on dialysis, chronic lung disease, aneurysm, dementia, etc. No? COVID vaccines are generally safe, and only the most effective vaccines and brands for senior citizens will be released and recommended to you. All of our vaccines have undergone first preclinical and clinical testing, 0, 1, 2, 3. The manufacturers have already determined the best dose. They have tested these on healthy adults. They have tested these on older adults. And now, as you have heard, no, there are reports in actual communities in various countries that say that a specific brand is now benefiting all of their vaccinated participants, I mean recipients in that country. So we now know in the real world that the vaccines are performing very well, even better than what we know of to be phase 3 clinical trials. And by the way, most senior citizens do not need to get clearance from their MDs. No, as long as you have your senior citizen card, or as long as the barangay can vouch that you're a senior citizen, konting-konti lang po ang nangangailangan ng medical clearance. Okay. But there are challenges, of course, no, as Dr. Ted Herbosa had said. Why are the numbers still low? Let me talk to you now about the challenges to COVID vaccination. Okay. Like, as mentioned earlier, we have been giving out the free flu and pneumonia vaccine for indigent senior citizens. And that may be a reflection of how COVID vaccine is now being accepted by senior citizens. Now, in that same study, Fit for Frail, we realized that there is some difference between urban and rural government, private versus private hospitals. And comparing government and private hospitals in urban and rural areas, more older persons were immunized with flu and pneumonia vaccines from government hospitals. So sanay na po ang government hospitals natin magbakuna ng senior citizens. And rightfully so. Now we know also that they're doing a good job, no, vaccinating our seniors with COVID. With regards to whether more vaccines were deployed by hospitals or RHUs, mas marami po, more vaccines were deployed by our RHUs. And this is probably a programmatic thing. They really gave the vaccines to RHUs. But again, few were vaccinated because it really is a supply issue, because the law says free flu and pneumonia vaccine only for the indigent senior citizens. And when you look at who were vaccinated, more, 54.1% were not vaccinated. And I think this is just really an operational and a supply issue, the same way that the COVID vaccine is facing a supply issue at the moment, but hopefully more vaccines will come. And among those who received the vaccine, more females, age 70 to 79, were vaccinated. No? Now, a similar study done by Dr. Cruz of UP Population Institute, DRDF, looked at vaccine awareness and inoculations of flu and pneumonia among senior citizens. And if you look here, many are not aware of the flu and pneumonia vaccination. And if only they are already used to vaccination, we probably would have an easier time convincing them about the COVID vaccine. So let's not forget about these important vaccinations. Okay, looking now again at the COVID vaccination rates, this is similar. It really came from the slides that Dr. Ted Herbosa had presented. So more than 1 million had their first dose, and roughly 250,000 completed their second dose. But note that some of our health workers na A1 were senior citizens and were vaccinated under A1. So there may be a little bit of undercounting there. And many of our A2 senior citizens also received AstraZeneca, and their second dose will be due this July. So hopefully by July, we will see an increase in numbers, okay? So, but there are other obstacles. Number one, lack of trust in vaccine safety and efficacy, lots of fake news that needs to be contested, conspiracy theories, ayaw ng anak, di ba? Napaka-importante pala ng anak. Kasi pag sinabi ng anak, nanay, huwag ka magpabakuna. Ba, susunod si nanay kasi paano naman nga siya pupunta sa vaccination center kahit gusto niya. Fear of needles. Sorry, but men have a fear of the vaccine needle. Maybe that's why even for the flu and pneumonia vaccine, more women accepted the vaccine. And unfortunately, those doctors who are now in this webinar, some of you do not recommend vaccination because you yourselves think that, oh, madami ng sakit, si Lola, si Lolo. That's ageism. No, that's a poor understanding of the geriatric patient population, because they are the ones who will benefit the most because they have these comorbidities. No, so let's not subject our senior citizens to ageism, that they're very fragile, that they're forgetful, that they're helpless. No, please, let's fight ageism as well. Now, again, Dr. Nicamille Sanchez, a social worker who is an adjunct of the Institute on Aging, did a study just a few months ago, looked at 70 to 100 senior citizens per Luzon, Visaya, and Mindanao, and did a thematic analysis. Many of the senior citizens are really worried about getting COVID, no? There are those who are undecided and do not want the vaccine, no? Because, as I mentioned, they're scared of side effects and efficacy. Because they also think the reason why they don't want is because they are sick, they have illnesses, no? And children, again, were identified to be an obstacle to vaccination, because if the child or the daughter's son does not agree, the senior citizen won't be able to access the vaccine. All right, so we did a focus group discussion with stakeholders with the DOH a few days ago. We had the Federation of Senior Citizens, Association of the Philippines, representatives from LGUs, representatives from the Philippine College of Geriatric Medicine, Philippine Society of Geriatrics and Gerontology. So we had a mix of government and civil society organizations participate, and these were the results, no? Again, as mentioned earlier, many are unable to register because they have no internet. No, yung mga nasa malayong lugar, wala rin silang load o pambayad ng load. And they don't have the cell phone. They just don't have the device, no? They are not techie. So hirap na hirap sila mag-register. May kailangan pa daw i-upload. No? Hindi na sila marunong. And the OSCA list, the Office of Senior Citizen Affairs, does not always have a complete list. And this really has to be updated. Especially those migrants, no? Those who came from other provinces, nandito dahil nagbakasyon lang na lockdown, or because they had forgotten to register, those are not listed and cannot be found. Again, access to vaccine center is a major issue. It's too far. There's no transportation. It's not disability friendly. Aakyat ka pa ng hagdan na mataas, no? And it is in a high COVID area. Si Ma'am Salve, at saka yung isa nating participant sa isang community, ang nagsabi niya, no? Merong isang community na inaway pa daw siya, sabi nung senior citizen kagawad, kasi yung vaccine center na pinapupunta sa kanila ay nasa COVID area. So, bakit nga naman nasa COVID area yung vaccine center na yon? So, we really have to have a good choice of where they should be going. And the closest the vaccination center is to their homes, the better. Okay, what strategies? Let's now go to strategies. So registration. Seniors need to be trained on how to use the Easy Consult. But again, as Kagawad Rona has said, there is now barangay-assisted paper listing. So the barangay really has to be very good. And fortunately, there are very good barangay kagawads, senior citizen kagawads, the entire community, even their homeowners associations work together really to find those senior citizens who may fall through the cracks. And I've seen that happen. In one of the districts here nearby, no, when they surveyed the senior citizen back in February, the hesitancy rate was 30%. But as seniors started to be registered and started to get their vaccines, recently the hesitancy rate is now down to only 10%. And only 5% will have said that never will they get vaccinated. So the list of hesitant seniors is really dropping when they realize that their friends, their neighbors have gotten the vaccine. So that is a good effect of having a good community program, really. We have to work together, no? And again, we need to tell our OSCAs, please update your senior citizen list. It is in the law that they have to update their list quarterly. Unfortunately, may isang probinsya na pinuntahan namin, 10 years na po ang kanyang OSCA list. Hindi pa nila na-update. Yun naman ang nakakapagtaka po. All right, next. So other strategy, supply. It really is a supply issue, no? The vaccines are only slowly coming in. Nahirapan ng ibang senior citizens natin kasi when they started to call them, sometimes only 10 vaccines were available. So they will call that barangay and say, oh, pumunta na ang seniors dito. Pagdating nila doon, only 20 vaccines were available to them. So that's very difficult for senior citizens. Buti na lang, ang mga seniors natin ay matsatsaga din at bumalik sila nung meron na ulit na bakuna. So I am really hoping that the more supply comes in, the better the vaccination coverage. Mobilization, like I said a while ago, is a whole society thing. LGUs, homeowners associations, even religious groups are now vaccinating, getting their senior citizens into churches or places of worship because they know them, they can find them, and they can bring them in. CSOs and NGOs, very important. No? Federations of Senior Citizens, COPAP, COSE, lahat yan. And celebrity endorsers, kailangan ba? Maybe, kailangan. Who knows? No? That might work. And one thing I know is that we need to train our doctors because there are a few doctors out there and even other health workers who say, wag nang bakunahan yan si Lola. Mga ano na yan, masyado nang matanda, bedridden na yan. Pero as Dr. Sandy said, meron tayong mga 100-year-olds at mga bedridden na binakunahan and are doing well. So we need to train our physicians, community workers on geriatric health, and very important, stop and identify fake news because that is very confusing. Okay, strategies again, distribution, workplace. Remember that there are senior citizens who are still working. Again, barangay hall, doorstep, church, home, including, by the way, group homes or nursing homes. Sama-sama kasi sila doon. Drive-through that is being done now. Maybe even pharmacies can start giving vaccines on site, no? As they are doing, for example, in the United States. Okay, we need to manage competing activities. We are now rolling out the flu and pneumonia vaccine. Some seniors had to delay their COVID vaccination kasi wala pa daw 14 days since they received the flu vaccine. Now, the CDC and the WHO is now saying you don't need to wait anymore. You can give the flu, pneumonia, and COVID vaccine simultaneously. But locally, our vaccine experts have to approve that. No? So we're waiting for the final approval of our vaccine experts about simultaneous vaccination. And of course, supplements, no? Alternative methods that are receiving a lot of hype and marketing. They're very, very aggressive on marketing. These have to be addressed. And of course, competing other age groups. Dumadami na ang nagbabakuna ng A3, nandyan na ang A4, susunod na sila. Baka naman maubusan ang senior citizens. Wag sana po, ha? All right, so public health recommendations. Health is a right. Vaccination is a right, no? It's in the law for senior citizens. We just need to expand, no, the RA 9994 to include free vaccination for all senior citizens, not just indigents. So sa akin, ang magandang tagline is, bakuna ko, karapatan ko. Karapatan ko ang mabakunahan. Okay, so we need to increase access to geriatric care. The House of Representatives Committee on Health unanimously approved a bill supporting the National Center for Geriatric Health Research Institute and Regional Geriatric Centers. Sana po ay maipasa ito para lahat po ng mga regions ay may geriatric ward, pati na rin ang mga clinic, mga LGUs, para matrain natin lahat ng geriatric health, ang mga workforce natin, and so that we can do a lot more researches to improve healthcare, no, to our seniors. And again, going to public health recommendations, we also have that DOH National Health and Wellness Program for senior citizens. Sana po matuloy ito because vaccination has to be within the context of wellness, within the context of healthy aging. No? Hindi lang po siya para hindi kayo mamatay, no? Para hindi mapuno ang ICU. Ang bakuna po ninyo laban sa COVID ay para sa inyong healthy aging and well-being. We also need, based on our studies, no, in Fit for Frail, we need a pandemic and disaster preparedness plan that includes senior citizens. That is one of the things that we found to be deficient. And more importantly, let's start producing our own vaccines here in the Philippines. No? that I think will complete the picture. Now, incentives, are they necessary? I think these will help. If you have a vaccination card, if a senior citizen has a vaccination card, nako, ang well-being and quality of life, napakaganda na, di ba? Kasi pwede na magsimba, magpunta sa mall, kumain sa restaurant, kasama ng mga kamag-anak at kaibigan, maaari ng bumiyahe, and yung mga vouchers na binanggit, no? Vouchers for vitamins. Sana we have vouchers for vitamins daw. That was a request based on our FGD. Maybe even family meals, no? Or raffle, yung iba, no? All right. And who do we give an award to? I think we need to award well-performing barangays, well-performing kagawads. We need to give recognition to families that have been completely vaccinated, and of course, organizations that have helped, you know, in the rollout of vaccines. Thank you very much. Yun lang po. You can contact us through our Facebook, YouTube, and our Institute on Aging website. Thank you very much.
Okay, thank you very much. That's Shelley De La Vega, who is the director for the Institute of Aging of the National Institutes of Health. Raymond, did you want to make a comment pa? Or we go to the next one?
No, let's go to the next panelist po. The Director Shelley, thank you so much po. I think it's a very important. Yes, ma'am. It's very important po.
Makabawi ka, Raymond.
It's very important po na there's an emphasis na not just the COVID-19 vaccines, but all the vaccines po na kailangan din po na kunin. Kasi that sometimes gets lost in the messaging, baka lang po COVID-19 vaccines yung tutukan.
Thank you, Raymond. Thank you, Susie.
Okay, thanks. Okay, our next speaker will give a brief reaction to our presentations and will impart some wisdom on how do we do this? How do we get our seniors vaccinated? No? And it's my honor to introduce somebody you know. He is, what should I say, the foremost transplant surgeon of the Philippines. He built the National Kidney Transplant Institute to the world-class institute that it is. And he was Secretary of Health. And of course, somebody we highly regard and respect. And we're just so happy that on his birthday, he's here with us. So I'd like to welcome Dr. Enrique on. Welcome to the webinar. Asan na si Sir Ike? Sir, asan na kayo?
Pwede na?
Yan, yes. Okay.
Yes, sir. Sir, kamusta na kayo? Happy birthday po.
Happy
First
birthday.
of all, thank you. And again, thanks a lot for inviting me to participate in this very comprehensive and impressive presentation on the problems of the aging population. Well, in terms of my commentary, I'd like to mention and magpa-excuse ako kay Shelley De La Vega. First of all, because this is the first time that I heard her speak, and at the same time, being more aware of what the Institute of Aging has been doing. As a matter of fact, I think during our term, noon, we wanted a more effort given to the development of geriatric centers because dumadami ng ating senior citizen. The figure that I hear is something like 8%. And that indeed is going to increase. And if you look at our PhilHealth, walang masyadong support. As a matter of fact, very little in terms of identifying a specific support for our aging population. But again, napaka-comprehensive ng presentation ng two speakers natin, both si Doktora and of course the comprehensive presentation also of Ted, showing us that actually hindi tayo kulelat, no? As a matter of fact, I think it must be impressed to the public that we are among the top performers now in terms of the number of or percent of the population that maybe kunti pa, but in terms of the numbers, specific numbers, maganda na ang ating numbers of the population that is being vaccinated. But going back to the specific subject natin of this morning, which is the problems that the aging population is facing and questions that are often raised. Bakit daw there is a lack of, or there is a observation na kulang ang ating percent of those that are being vaccinated. And I think Shelley already explained quite well the reasons why they have some difficulties. And of course, the main difficulty really of this population, I think, is accessibility or yung convenience. And the reason for that is very obvious if you read the commentaries of at least 2 or 3 columnists on their experience. For example, yung isa diabetic siya and napakatagal yung they were made to wait at, since he had taken his anti-diabetic yung insulin niya, nagugutom na siya. And so all of these small factors made it difficult for the seniors. At the same time, I think it's also important to categorize natin ang ating senior citizen. I think the problems of those in the those who are 60 years old would be quite different compared to the problems of the septuagenarians, or lalong-lalo na yung octogenarians and even those in their 90s. And of course, the associated comorbidities that these people have. So I think very important that the community must have a list of not only of the seniors, but the comorbidities that the seniors do have, so that they can really be specifically assisted. Parang they can have it maybe in terms of physical assistance, so that they can be brought to the vaccination centers. I really don't have to add much anymore to the presentation of Dr. De Vega, because kumpleto eh. Ang ganda ng iyong analysis of the problems of the seniors, of the aging population. And I think that this webinar that we are having this morning or this afternoon now should really be made available to the public. Rather, when I say to the public, meaning to the press, to television, and the radio, because karamihan talaga ng objection lang naman ng mga seniors are essentially in terms of accessibility and assistance based on either their incapacity to enroll themselves because of lack of knowledge on using the IT or the internet. And second, of course, is their capacity to go to the center. So I'd like also to take this opportunity to commend Ted for giving us a very comprehensive and current information on the status of our vaccination program and the expectation that the public can have for the next 4 to 8 months. Now, of course, napakaganda na, I think, ang ating program ngayon, and it's only the availability of the vaccines, but it's nice to hear that we're going to receive several millions of these vaccines coming the next 2 to 3 months. And with Ted assisting, of course, General Galvez. After all, I know that Ted has been behind. Maybe not known to most people. Dr. Herbosa is actually I think the man behind the one helping the most our general in being able to achieve the extent of the vaccination program with the, I think sinasabi ko pa rin, not that much gulo compared to what we hear from other countries. So again, maybe what I would add is that this epidemic shows the importance of paying even more attention to our senior citizens, and even for the public to understand that the senior citizens they have a lot to still contribute to the advancement of our country. And I know that this kind of webinar is really what we need to make the public understand that meron pang magagawa ang ating mga senior citizens. Thank you for this opportunity, and I really appreciate the opportunity to listen to this and participate in this webinar. Thank you.
Thank you very much. That's former Health Secretary Dr. Icona.
Yeah.
As I said, no, malalim talaga mag-isip si Sir. Okay. Kailangan i-categorize natin yung mga seniors kasi hindi sila pare-pareho, no? That's such a sharp insight into that. And, Sir Ike, I hope you'll stay so that we can discuss further in the panel. Okay, so yeah.
I think I really would like to re-emphasize that iba ang problema ng person ng population in their 60s,
Yeah.
and you compare it with the population of those who are in their maybe 75 and older.
Yeah.
And again, to go back to the need to understand and give more attention in public health with regard to our geriatric population, not only in terms of healthcare, but health support coverage, lalo na sa ating PhilHealth. As a matter of fact, we're trying to suggest that there be an accessory so-called premium or coverage that will be defined essentially for the geriatric population, but maybe identified it for those who are maybe 75 and above.
Yeah.
Thank you.
Yeah, thank you very much, Sir Ike. No, and I think let's pick up on some of those points later. That this is not just about the vaccination of seniors, but it's their wraparound services. It's about their total care. Okay, over to you, Raymond, for our next reactor.
Thank you, Secretary Ona. Maligayang kaarawan po ulit, sir. We hope to be able to gain more insights during the panel po, sir. Maraming salamat po. And
Thank
then
you,
for our final po na reaction for today, final speaker, we have, she will be talking about po from a public health perspective. And really the coverage po with regards to senior citizens, how it can be improved, her maybe personal experience na rin po, none other than one of the commissioners from the Commission on Higher Education, Dr. Lilian De Las Llagas. Lili.
Magandang hapon sa ating lahat. Ako ay natutuwa at ako ay huli sapagkat ang maaari ko pang sabihin ay nasabi na ng iba. Kaya I don't need really to repeat questions. I don't need to repeat some of the things said. My opinion is the opinion poll provided some insights already. These are basically indigenous beliefs based on indigenous knowledge. The presenters provided greater understanding on various aspects of COVID and COVID vaccines. As a matter of fact, Dr. Ted gave a comprehensive narrative on the local and global situation, provided empirical data and analytics, success stories, and government's response, giving a certain level of hope. Dr. Shelley equally provided a comprehensive narrative. She gave us data, analytics on the basic epidemiology of COVID, issues, strategies, and public health aspects as well. It is a very comprehensive narrative, in particular, a public health perspective. So I really do not know if I am still do I still need to say something after Dr. Shelley? What can I still say? Dr. Shelley provided the basic elements of epidemiology: who, what, why, when, where, and how, obstacles to vaccination, and public health strategies. I must say that the virus is a novel virus. Its local epidemiology has not been fully established. We know very well in the field of public health that once the infectious agent has not been fully defined, it is very difficult to fight. The COVID virus viral biology, viral characteristic, viral drift, mutation, viral strains, and pathogenesis have not been fully defined. I'm happy to hear from Dr. Ona as well, saying that it is important to have system in place, in particular, database profiling of senior citizens.
Ma'am,
This
sorry.
is very important.
Ma'am, you've lost your video. Maybe you just need to, there you go. Okay, thank you po.
Okay, bumalik na po. Thank you.
Okay, sige po. Sorry po. Sorry for the
Did you hear me well? Where do I
Yes,
start?
ma'am. But we lost your video for a minute.
Just continue, ma'am. Yung video niyo lang po nawala, pero okay na po.
I am very glad Dr. Ona mentioned about database profiling of senior citizens. We start with the database to determine the entry and the exit points of our intervention programs. It is also worthwhile knowing, from the point of view of a fellow senior citizen, that this pandemic emphasizes the value of senior citizens in the Philippines. And therefore, what can I still say after hearing the presenters and the reaction? I want to believe that I can still say something that can contribute to the paradigm of vaccine problems and issues. Let me supply some concepts, principles, constructs, a model, and some insights. The episode of Stop COVID Deaths, Help, Ayaw Magpabakuna ni Lola at ni Lolo, or vaccine hesitancy. I like to improve this by saying, ayaw ko ba? Hindi ko ayaw. Gusto ko din. Kaya lang sigurado ka ba na hindi ako mamamatay? This is where I'm coming from. The vaccine is available, but there are uncertainties, beliefs about the vaccine. There's so many brands, so many people talking about the brands with different branding, different claims, different labels, and therefore, it is not really very easy to understand from the point of view of a senior citizen. The health belief model I fully subscribe to. As a person who has been in the practice of public health, focusing on the control of vector-borne diseases, in particular dengue and malaria, we have subscribed and had advocated on a health belief model. It is a tool that health scientists use to try and predict health behaviors. This model is based on the theory that a person's willingness to change their health behaviors is principally due to their health perceptions. Example, people will not change unless they believe that they are at risk. Seniors who do not think that they will get COVID are less likely to get COVID shots. The most vulnerable population who are at risk based on science are not convinced that they are at risk. Why? Scientists Bishop and Glantz posit 6 constructs influencing health attitude and behavior as applied to COVID. May I now enumerate this? Low susceptibility. They do not think that they will catch the virus. They rather stay at home because they are not allowed to go outside. How come this time they are compelled to get vaccination and go to the vaccination sites? Low seriousness, severity of the disease. Anyhow, media, written, newspaper, videos have been showing more recoveries than deaths. So why not stay at home, and why should I go to the vaccine sites? Personal reasons and preferences as my number 3 construct. Cultural beliefs. Filipinos would say, I am already old, di bali na, kaming matatanda, sa bata na lang yung para sa amin. Ito ay isang ugali ng Pilipino culturally, mapagparayang ugali. Ito ang nakikita ko at nalalaman ko na kung dahilan ang mga senior citizens natin na kung saan nakatira sa mga areas na hindi naman masasabing komportableng buhay. Nais nilang ibigay sa kanilang mas mahal sa buhay na mas bata. Perceived cause after vaccination, fear of side effects, as has been mentioned earlier by Dr. Shelley, and deaths. Ang sabi, mahal ang mamatay. Totoo naman talaga, mahal ang mamatay. Perceived discomfort in vaccination centers. These are really challenging situations propounded by one of the person interviewed. Napakahaba ng linya, napakainit, at wala naman sasakyan talaga para magpunta sa mainit na lugar. Perceived past experiences, I believe, was one of the reasons why people are hesitant, not even the senior citizens. Let's recall the vaccine, dengue vaccine scandal. We still have that kind of problems. As we know, as a person working in the field of dengue vector control, we are experiencing refusals in the community because of this vaccine for dengue scandal. The speakers gave us the best information and situations to fully empirically see the pictures surrounding the episode. I am a senior citizen. I still feel I am not safe. So I have 4 questions or 5 questions. Can I still get the virus after the vaccine shots? Yes, because it does not prevent infection and infecting others, I told myself. There should be a very good explanation by an explainer on what viral COVID infection is versus COVID disease. Are the vaccines safe and effective? Yes, according to the claims of the pharmaceutical companies. Very limited science study, as we know. It takes years in order to come up with a fully clinically trialed study of any candidate vaccine. Yes, flu vaccine and flu vaccines are experiences of the senior citizens. But I must say, these pathogenic agents are not novel in nature. They have been studied fully well. Are there risks of complications when given the vaccine? Is going out and mixing with people safe? Such, I was compelled by my barangay, I must stay at home to be safer. It contradicts, therefore, going to the vaccine site, which I am confused. How many people have acquired COVID after being fully vaccinated? Of the 11% vaccinated, as shown by data, how many died? How many really are in good condition? From the perspective of public health, through health communication and promotion disciplines, there is a need to build understanding and communicating, a need to communicate for behavioral impact. A long-term health communication plan with the health crisis communication strategies pre-COVID, during, and after COVID. We need a health crisis communication expert. Utilize the integration communication strategy, utilize data for risk factor analysis, message by the messengers to the desired publics must really be studied very well. In particular, when we are addressing messages for senior citizens, this must be behaviorally focused. The aim is to determine measurable changes in behavior, not just knowledge, not just attitude. Let's strengthen engagement aspect of public health. We can engage senior citizen group as the influencer. Choose who are these other influencers. They must be trusted, they must be respected in the community. Perhaps a good spokesperson would be someone who is a senior citizen, 70 years old, has been vaccinated, but still say, look, I am okay. Explain reasons for seniors' compliance based on empirical data. The caregivers and family members must be given appropriate information, updated information, not from the non-experts, not from the opinion makers. DOH would be very good source of information and definitely should be the institution responsible to protect and promote health of the Filipino people. WHO as well, and other authorized explainers. Build the competence of the BHWs as messengers. My question now, am I safe after my first shot? I got my first shot after last March 16. Yes, I will not die. I am protected, presumably, based on labels and claims, and also my doctor's prescription. No, I can still get COVID, as the vaccine is not a preventive vaccine or a prophylactic vaccine. I still need to observe public health protective measures and prevention measures. The virus is a novel virus. We really need to know a lot of things. And because of that, there are things that are very uncertain to us. It is important that the many messengers of information, the many speakers about COVID and COVID vaccine be regulated as people are confused whom to believe. We call this infodemia. Ang infodemia ay isang bagay na nakakaroon ng hindi magandang epekto sa tao, lalo't lalo na senior citizen, hirap ng makinig, hirap ng makatanda, at hirap ng sabihin, baka ako mamatay, hindi ko masisigurado yan sapagkat hindi ako nasisigurado na ako ay mamamatay. So these are my insights. We need a very good information, education strategies, and we really need to build on strengthening our communication strategies. We need to be focused, we need to be behaviorally customized, and improving knowledge, by the way, will not be translated to improving behavior. On that, I like to say, these are my insights, these are concepts, and this is my understanding about public health related to COVID and vaccination. Maraming salamat po at magandang hapon.
Okay, thank you very much. That is Commissioner Lilian De Las Llagas of the Commission on Higher Education. Okay, so Raymond, we're going to call back everyone into a short panel. In the interest of time, we'll just have a very short discussion, but we will have Director Grace Alfonso. Let's have Dr. Ted Herbosa, Shelley and Secretary Ike and Ma'am Lilian back into the plenary. But before we start, Raymond, did you want to share the final feedback from the opinion poll?
Okay. Can we have that be flash on the screen? TV, yeah, there we go. So, as for our opinion poll, and ulitin ko lang po, this is also the same set of questions that we have for the Mentimeter. The first question is shows that 56% of those who responded po, they have at least one senior citizen relative na ayaw po magpabakuna. Doon po sa pangalawang question, in your opinion, what are the common reasons why they don't want to be vaccinated? And there are multiple answers po, but 84%, that's the top most selected po, they are afraid of side effects and complications, followed by 38% distrust on the experimental vaccine, and that is followed by very closely a watch and wait approach, and also they are afraid of getting COVID at the vaccination site po, no? And the rest are equally distributed in terms of mobility issues, convenience, and if they are afraid of the needle. So maraming salamat po for our more than 730 respondents sa ating poll questions. There's an opinion poll lang naman po, and we still are very grateful that we have more than 1,200 attendees in the Zoom webinar po.
Okay, thank you very much, Raymond, and thank you very much, everyone, for participating in that. I'm just going to throw one question to our panel in the interest of time, because we're close to the top of the hour. So we just like really a quick feedback from you. I mean, we've heard a lot of things that we need to do. There's like big systemic things. There are sort of some structural issues that need to be addressed. But I think what as Ted has been talking about this, the objective at this point in time is to get the seniors vaccinated ASAP, right away, ora mismo, ngayon na, now na, okay? So I just want to ask everyone, just name one thing maybe that families need to do to help get the seniors vaccinated. Anong kailangan gawin ng pamilya? Kasi gusto ko yung sinabi ni Sir Ike talaga, it's stuck in my head, na iba-iba, no? Different ages, iba-iba talaga yung pangangailangan nila. So ngayon, you know, ang kauuwian din ito, mga kasamahan nila sa bahay, you know? And families, and also, you know, our audience are really health workers, nurses, doctors, frontliners. What is one thing that we can do to increase these numbers? And we need to do that right away. I mean, this is not a long-term thing. It's like right now, we need to get more seniors vaccinated. So we'll start with Gigi. What do you think?
Thank you. Kailangan i-target natin ang mga anak. Ang laki ng influensya niyan. Doon sa ating mga public service announcements, aside from senior citizens, yung involvement ng pamilya, yung mga anak to facilitate for them to bring them to the vaccination center. Kasi ano yan sila yung araw-araw nakasama. So we need to do that so that we go to that fastest time possible, we reach the next normal. So bring everybody to the vaccination center. Okay.
Yeah, I like that direct, no? So parang our communications is not really directed at the seniors, but at the children or the ones
bring them,
who enable them, right? Ted, what do you think?
I agree with that, but the other thing that you should actually look at is the socio-cultural dimension of how we take care of our elderly. Unlike other countries wherein there are really segmented programs really for the elderly, we tend to say the family takes care of their seniors, their Lolo and their Lola. And that's how we do it. And that's why I think the best approach of the government is not really to segment that sector, but making sure that the family really supports the vaccination of our senior citizens. Kasi hindi sila nasa nursing home. In other countries, the aged are in the nursing home. So UK wants to vaccinate them, you just go to the nursing home and vaccinate everybody in the nursing home. Here, they're at home. They're at home, and some of them have mobility issues. So I think the real key is working it from a family-centered, socio-cultural dimension of targeting them. So it has to be family. So other than the younger, it's really the family that will convince their own seniors. And next to that layer will be the LGU or the barangay, maybe the barangay, because the barangay knows who are the seniors in a particular barangay. So it's got to be that whole of family, whole of community engagement to really push the seniors into the vaccination centers. Back to you, Susie.
Thank you, Ted. Shelley.
Yes. Matagal ko na tong sinasabi, we need to vaccinate families and involve families in vaccination. Totoo yan, lahat ng sinabi ninyo. Agree ako dyan. Of course, given that we still lack the supply, hopefully when the supply comes, we do advocate to families. And very effective talaga ang vaccination if the barangay works with families. That's what I've seen so far. Successful vaccination programs depend on very good barangays and a close-knit barangay family system. That's what works.
Okay, thanks, Shelley. Dr. Ike. Dr. Ona.
Sir, you're on mute. Secretary Ona, you're on mute, sir.
Okay.
Go ahead,
Okay
sir.
na? Yeah.
Sir, nakatakbo po yung camera nyo.
Yan, okay, sir.
There, sige.
I agree with yung sinabi nga ni Dr. Lilian De Las Llagas that, you know, in the Department of Health, we did some social scientists, anthropologists, and social psychologists. Kasi nga, ibang-iba ang dating and problems and in understanding the elderly, and at the same time be able to segment kasi iba-iba, I'm sure, ang problems, no. Now, of course, when you talk of physical disability, very important yun ng ating public health system ay knows kung sino yung mga senior citizen in their barangay, and lalong-lalo na kung sino yung may physical disability, because they would be very it would be very difficult for them to go on their own, lalong-lalo na for the, you know, the lower income bracket. At the same time also is the yung technology in helping them be able to register. And I know very well of several who they had to really look for special assistance, and even their barangay could not offer it. So hindi sila ma-register through wala naman silang email, and a few of them don't have even a cell phone. So yun ang isang difficulty of our real elderly na nasa, you know, in the octogenarian age and older. Now, in terms of yung sinabi ninyo, I totally agree with that, na the family and of course the community is the most important aspect ng information to convince them. But I think the doctors, you know, I had numerous tawag during the past month, and of course being asked by our elderly friends, yung kanilang fear of being, or not necessarily fear, but information, the need for information that it is indeed safe for an elderly or a senior citizen to receive a vaccine. Actually, kulang yung information na naibibigay because, you know, for some reason, kulang siguro on television or maybe on radio or even on other sources, wherein bombarded pa sila ng hindi nila malaman whether it is a fake news or a wrong news at all, or wrong information. And that is what is necessary. And that is where the Department of Health, I think, has to come in. Bringing in so-called experts for those that understands the problem of the aged population.
Okay, thank you very much, sir. Ma'am Lilian, go ahead.
Yeah, I will return to my communication behavioral impact. There's so much message, many messages in the television, prints. So I focus message for the senior citizens. We really need to have a very focused message for the senior citizen. What should the message be? It's not to increase knowledge, but to increase compliance, because they have trust on the vaccine and they have trust on the information. The presentation of Dr. Shelley is a very good scientific basis for the Filipinos to trust. Let Dr. Shelley talk more. Let Dr. Shelley come up with a message or good information education campaign, behavioral messaging, the one preparing this message. Example, for dengue kills. Somebody said, I am alive and happy. So how will you contradict that? What would be the message for the senior citizen? That is my focus, Dr. Susie.
Okay, thank you very much, ma'am. Raymond, we have one or two questions from the audience. So let's take our questions and then we'll have to close because we are a little over the time. Go ahead, Raymond.
Okay, thank you. The first question will be coming in from our audience member, Maria Jane Villanueva po. If you could open your video and ask your question, ma'am.
Good afternoon. Good afternoon.
Good afternoon. Yes, ma'am. Go ahead.
Thank you for organizing this kind of webinars, which is very, very helpful to all the population and that are supposed to be vaccinated. But my question is more on here in our LGU. I find it very hard to get the elderly because at present, no, I am in charge of the elderly people here in our wellness center, and I have tried the online registration several times, and until now they have not given us a schedule. And I have contacting them. I asked the help desk of Quezon City and referred me to the LGU where we belong. And I have contacted the person in charge. And until now, they have not given us the schedule. I have talked to the person in charge of the schedule, and she said that they are going to call me back. And I have been waiting for more than a month and nothing happened. So I don't know how can this be addressed, because our elderly here are willing to be vaccinated, and yet no vaccination is available for us. So I don't know.
Okay, so maybe we're going to throw that question to Shelley and then maybe to Ted. Shell, go ahead.
That really is programmatic. I think maybe Ted would be more on in a better position to answer that. But I think you can now write your counselor kung kilala mo yung konsehal mo. At maybe even write the mayor. Kasi talagang nakasalalay ang rollout sa barangay.
I tried already contacting somebody who is near with the mayor, Joy Belmonte. I already have contacted a person close to her, and but what she told me is that we just have to wait because vaccines are outnumbered by those who are willing to be vaccinated. So I don't know.
Ted, what do you think, Ted?
Yeah, I see the figures, and every morning we meet in the National Vaccine Operations Center, and I see the progress of 2 cities that are very fast in vaccination. It actually belies the problem that she's stating, which is Manila and Quezon City, are two of the fastest. They average about 20,000 vaccinations per day. Now, her problem is the fact that Quezon City is a huge city. It's actually the one with the largest population. So in terms of scale, talagang makikita mo na compared to, let's say, Pateros, na siguro nakuha na nila yung mga senior citizen nila in one go or in a week. Itong Quezon City is taking weeks and months to actually schedule. The other thing that they had a problem with was their vaccine administration software, which had problems. So my key is, well, to address your specific problem, I'd give the same advice na kailangang yugyugin mo yung LGU, because the administration of the vaccine is not the national government. It is the local government. So the local governments are in varying capacity and capability. May mabilis, may magaling, may equitable, may nasisingitan sa pila. So you'd actually have to fight for your right, because we must have equitable distribution of the vaccine following the priority listing. So dapat yan prioritize talaga sila. So for your confidence, what I can do is I can look at the specifics of Quezon City in terms of their senior citizen. I haven't looked at that. Kasi baka dumadami yung A3 nila, nakakalimutan nila yung senior.
Tingin mo na sa chat box yung barangay mo.
Yung barangay at saka yung
pangalan. Mo nga yung barangay mo para malaman ko. And then, kukulitin natin yung city health officer.
Maybe I can just say it.
Alam ko, ang ginawa ng Quezon City, nag-barangay by barangay.
Holy Spirit.
Barangay Holy Spirit.
Oo. Baka ibigay natin, Doc Susie. Kunin natin yan. Baka next week meron tayong answer sa kanya. We'll do that. Pakilagay lang ang pangalan.
Yeah, so she said it's Barangay Holy Spirit, but I usually don't give inputs, but I will. And what they do in other places is, while the national government is not in charge, the national government could have some kind of an oversight, like an oversight function. So, for example, like our person who questioned, no, dapat merong pwedeng puntahan, tawagan, para sabihin, dito sa amin, wala. Right? And at the national level, there should be a way of tracking saan ba itong mga hindi nangyayari. Kasi while it is the responsibility of the local government, there is some kind of an oversight responsibility for the national. This is just my opinion as I've seen it in other places. So input ko lang yun. I don't know if that's something that can be done. Na parang meron mapupuntahan.
You see, Dr. Ona wants to say something.
Oh, go ahead, sir. Go ahead. Sir.
Ang tingin ko nga dyan, until we really have a national ID wherein you can easily identify right away. I don't know kung ang ating barangay, of course, they claim they have, pero nasaan ang listahan nila ng kanilang mga senior citizens. If you really look at it, until we really have upgraded our IT capacity together with a national identification and have categorization, that this information at your fingertips, masosolve natin yung ganyang problema. Right now, really, it's a matter of not necessarily well, it's a problem of size, of course, numbers, but at the same time, meron din namang advantage sana dito ng ating so-called national DOH being able to give the direction. But tama-tama rin naman ang implementation really has to be at the barangay level. Of course, meron maliit na barangay, meron namang malaking barangay. In much the same manner with regards to the cities. But again, the solution to this is really an upgrading of our IT capacity. And I think it's coming, but doon pa rin tayo nagkukulang. That's why you have this kind of difficulties.
Pero Secretary Ona, ang senior citizen natin may ID lahat. They actually have ID because it is a 20% discount. So yung Quezon City, may listahan sila dyan kasi I'm from Quezon City and I know I got my ID in an office. So that office has computers. So they have a list of all the senior citizens and their address and their contact number, their barangay. So hindi ko rin talaga maintindihan bakit hindi sila pwedeng, anong tawag dito? Sila na mismo ang humabol dito sa mga senior. Kasi sabi ng national, bakunahan nyo itong senior. Dapat ganun na lang ang ginawa nila. But
Pero
pinag-ihipuro ko yung senior.
Pero ang information kasi ibibigay mo individually. Samantalang kung meron kang IT system, isang kwan lang yan, mabibigay mo kaagad. So in short, it still is interoperability of those IT systems that will really facilitate being able to give all those information until we achieve that, which other countries, especially Taiwan and maybe Singapore or to a certain extent Thailand has already, malapit-lapit na rin tayo doon, but wala pa. And I think these are really what I call birth pains that hopefully will be solved. Well, I hope wala nang ibang pandemic na darating pa.
Shelley, you wanted to say something?
Yes, sir. Kami ni Susie, we conducted the Fit for Frail, and one of our major policy briefs is a robust health information system, including those issues that you mentioned, interoperability, for example. So yes, a robust health information system would make it easier.
Yeah, I agree. I mean, the two LGUs that I know very well, Taguig and Bataan, they have mapped to the level of the household kung sinong may aso. You know, who has who needs a wheelchair. You know, yun yung level nung information na kayang gawin ng LGU, but these are relatively smaller LGUs compared to Quezon City. But I think what Sir Ike is saying is really a national, like an electronic medical record system for the whole country. But that's for another topic, and I think this has been a very exciting discussion. Raymond, do we have one more question, or we're going into closing statements now?
One more question po, this time coming in from Sir Nathaniel Young.
Go ahead.
Hi.
Go ahead po.
Good afternoon.
Good afternoon. We can hear you, sir.
Thank you. I just wanted to say hi to Dr. Ona. I hope you're doing well.
Thank you.
My question actually was, if most senior citizens do not need to have medical clearance, as has been said during this program, why does the fallacy of needing such clearance still appear to be pushed by those in the trenches who are conducting the vaccination program? Are there clear-cut guidelines that can be disseminated to the general public through mainstream and social media platforms of the relevant government agencies, such as the DOH, that can be seen by those planning to have a vaccine, and shown directly to those who are in the vaccination centers?
Yeah.
I think that's for Shelley. Shelley,
Yes.
say.
There are guidelines, and the DOH has been sending out these guidelines to our implementers in the field. Unfortunately, there are people in the field who are really fearful of side effects, etc. In our experience, being a member of NITAG, I have worked closely with our barangay and our vaccine implementers, and I have shared the guidelines, such as, for example, you can have your vaccine even if your blood pressure is 160/80. Our senior citizens know that because I have shared that as a right to know. So kanya-kanya din talaga. So it really depends on how that information is disseminated to your senior citizens in a way that is understood easily, because the DOH, of course, gives out guidelines for doctors. So yes, perhaps a similar, simpler version can be shared to the public.
Okay, thank you very much, Shelley. All right, we are running out of time, and now we are going to go to your final statements. I'm going to ask the panel, but while we're doing that, Raymond, we might want to flash on the screen our...
Dr. Susie, can I raise a question for Dr. Ted bago ko mag-board meeting?
Yes, go ahead.
Yes, I'd like to ask Dr. Ted, Do we have a national COVID communication plan?
Yes, we do. We have 3 groups that actually work in our comms plan. There is the Res Bakuna program led by Beverly Ho. And then there's the PCOO that also has the Laging Handa and the daily comms of Secretary Harry Roque. And lastly, there's the private sector that you're hearing now. They call the T3, which is the Bakuna benefits, the one that I showed. They have the T3 Bakuna town hall meetings as well. And they all work together. They're a cluster, the communications cluster. We call them strategic communications cluster, work together, and they identify this as
yeah, thank you, Dr. Ted. If I ask you, what should be the message for senior citizen, just to appreciate the intent of this?
Yeah, I think the message should be that the vaccines are safe for seniors.
Because the
the senior
messages are quite
citizens.
general.
Yeah, the senior citizens need to be. I think the hesitancy is really about side effects. We saw that even in the poll here.
So, what do we need to tell the senior citizen? Just
So
to
that the
end up my
vaccines are
question.
safe and effective for them. So,
But
I think,
because there is distrust, how do we address the distrust?
well, you fight the fake news and the myths. That's the problem. Our problem is social media. Social media has a lot of this disinformation and unreliable information, and we need more talking heads that are reliable. More people like Shelley talking out in the public.
Yes,
Shelley
that's
should
right.
come
Ako
out
pa.
television. Edsel Salbanya should talk out more on television, or the other people that are believable. Secretary Ona, key opinion leaders who can give out statements so that it can convince the unconvinced. Actually, it's the middle sector, about 30% who are undecided. They're the ones that are
Okay,
convincible.
thank you, Dr. Ted, for these very focused answers because these are my anxieties about the current community.
Niribalida pala ako ni ma'am.
Kasi marami tayong sinasabi pero hindi yan nasusunod at hindi naman ini-evaluate anong nangyayari sa ground. Thank you, Dr. Ted. That's very affirming.
Okay, thank you very much, everyone. We will ask everyone to speak for less than a minute and just give your final remarks. So we're going to start with Ma'am Lilian. Your parting words to our audience, less than 1 minute.
Ang sinabi ni Dr. Herbosa ay nakakagalak at nais kong makita na ito ay patupad. Marami pong salamat.
Thank you very much. Sir Ike.
Well, siguro ang gusto kong sabihin lang, and I hope lahat na nakikinig should tell all the seniors that they know to assure them that this is indeed a program of government that they should wholeheartedly support at huwag matakot because this is well studied, and the advantages definitely is so much compared to the so-called fear that they have. So magpabakuna lahat ng mga seniors.
Thank you very much, Sir Ike. Shelley.
Yes, vaccination is recommended for seniors. Huwag matakot. All vaccines are safe and effective, especially in reducing hospitalizations and death. But more importantly, ang inyong kalusugan ay inyong karapatan. At ang pagbabakuna ay inyo ring karapatan. So, bakuna po ay karapatan ng lahat, lalong-lalo na ng senior citizen. Salamat po.
Thank you very much. Ted?
Well, sa mga senior citizen dito na hindi pa napapabakunahan, payo ko sa inyo, magpabakuna na kayo. Kung may kasama kayo sa bahay, which is many of the people here, na may senior sa bahay, kumbinsihin nyo sila at ihatid nyo sila at samahan nyo sila sa vaccination center para magpabakuna. Maraming salamat.
Thank you very much.
Salamat. Salamat sa inyong lahat.
Direct Gigi.
Okay, ang one-liner ko, lahat tayo, we are a community, encouraging more people to be responsible and take ownership in the conduct of public health in our everyday lives. So maraming salamat.
Thank you very much. We'd like to call on the Dean of the College of Medicine of the University of the Philippines, Dean Charlotte Chiong, to give also her short summary of today's webinar. Go ahead, Charlotte.
Yeah, we are about to conclude the webinar number 55. And of course, the theme is health. Ayaw magpabakuna ni Lolo at Lola. Everybody will agree that we actually covered a lot of ground in the past 2 hours. There was great hosting, as always, thanks to Dr. Raymond Sarmiento and the President's Special Envoy for Global Health, Dr. Susie Mercado Pineda. Professor Emeritus and our TVUP Executive Director, Dr. Grace Alfonso, gave the opening remarks, who consider this webinar as a community and claiming that claiming this to be our space, with more than 300 top experts already being able to give information to counter the fake news, tinatawag na infodemic and fake news. And the need for authenticity and the transparent discussions that will show how passionate we are as frontliners, as healthcare workers, to provide science-based solutions given the social-cultural dimensions of Philippine society. She actually gave us an overview of how this webinar actually comes to life and the efforts given to this webinar. The synergy that has been exponential, hundreds of thousands already being able to reach not only the country but even worldwide. Sabi po ni Direct Gigi, we are all agents of change. Seniors especially have to be protected in this pandemic. Pagsusuri ng bayan ay kailangan. The first presenter was world-class trauma surgeon and disaster expert Dr. Ted Herbosa, who's also special advisor to the IATF and Vaccine SAR Carlito Galvez, who gave us an overview of the complex emergency that we are in right now, as well as the socio-political instability that's really akin to a world war. He noted that we are now in the phase 3 of the National Action Plan that is now looking at economics and balancing this with our pandemic situation. And that for the first time, we have more actually increasing numbers in the regions outside of NCR, as well as the more common B1351 more than the B117 variants of concern. He also gave us some data regarding being able to look at the utilization of our hospital facilities, which actually peaked at around 88% during this pandemic, where we didn't have rooms available and people were dying in stretchers in the emergency room. So our goal really is to save more lives and recover our economy. As a vision, we have 3 imperatives, and that's TTT. That means we'll have to be able to detect, we have to trace and treat. We need to improve our border controls, and we also have to be very aggressive with our vaccination program, increasing the demand for this service, as well as being able to monitor the adverse events. And in the last phase is really to be able to adapt to innovation and perhaps even have our own vaccines, our own protocols, our own data regarding mixing and matching. That's still up in the air. We are very hopeful that there will be more vaccines coming in through the government and through the private sector initiatives. And we first heard now about bakuna benefits. You know, mga 28 to 29 pages ho yata yung bakuna benefits. I was sent a PDF by one of my classmates, Mingita Padilla. And we are looking forward to having all these campaigns in order to actually improve the uptake of vaccination. Several polls have been done. We know about the myths, about DNA, about microchips, about nanoparticles. We also have private sector initiatives in order to counter the slow rollout, and that means making available Samsung Hall, other vaccination sites, so that it will be more convenient for our seniors. And that there's about more than 10 million that will still have to arrive in the next few weeks or so. With more than 8 million now Filipinos having received the vaccine, we're very hopeful that we will be able to reach our target, and perhaps in 1 year should be able to mitigate this pandemic. So we're now at a daily average of 145,000. And we peaked at 150,000, and even topping Thailand, Indonesia, and Vietnam, and other neighboring countries. So with 5 million now vaccinated, tayo na raw po ang pinakamabilis sa ASEAN, and we have 4 of the 7 brands here in the country. And with more LGUs scaling up and even doing house-to-house and even private businesses being involved, siguro po ay maatim natin ang ating goal. So ang main issue po dito ay walang iwanan. Lahat ng sector of society, especially our seniors, should be given that vaccination. We'll have to exert our best efforts. The presentation of the second speaker, Dr. Shelley De Las Llagas, as usual, is excellent and very comprehensive. As the country's leading geriatrician, Dr. Shelley De Las Llagas gave us a lot of data looking at the number of seniors now in the country and the projection of how many seniors there will be in 2050. Dumadami po ang mga seniors natin. She highlighted the long haulers and with COVID. And because of this, she actually emphasized the fact that seniors really need to be vaccinated because of the benefits will really outweigh the risks. She gave us the fit to frail study that she did, and frailty being a reduced strength. We have now about 15% in our population who are frail, about 61% who are pre-frail, and 19% are robust. And therefore, she said that those who are pre-frail, we can still improve them by giving more support so that they will be with robust health status. We need to emphasize that our elderly will need to live meaningful lives. And therefore, ageism is something that we have to combat. Wag natin pabayaan porque matanda na sila. Although alam natin na mapagbigay ang ating mga seniors, ang mga lolo at lola, we need to look after them. And she highlighted the fact that minsan, it's really the lack of trust, or even the children wouldn't want their senior elders to be vaccinated. And this is something that we have to address. She also said that during the stakeholder meeting, there's really a lot of gaps, no, in terms of technology, because they don't have gadgets, they don't know how to use the internet, and also because of accessibility issues. They need to be transported, and therefore family members will have to bring them to the vaccination sites, or vaccinators will have to go to their homes if they cannot travel to the vaccination sites. So she also highlighted the fact that we have to recognize our kagawats and barangays who actually really worked hard in some barangays to be able to afford this vaccination available to our elderly. So today's reactors are truly national gems. We have our world-class transplant surgeon, former DOA Secretary Icona. Happy birthday po uli, Sec Icona. He highlighted that more field health support is needed for aging population. He highlighted also the fact that the convenience of seniors will need to be considered, and categorization is actually something that should be done because the needs of the 60 to 70 age group is different from the needs of the 80 to 90 years old age group. And technology and transportation gaps that will have to be considered. We'll have to also look at the other types of data that need to be upgraded, including giving more attention to the 75 and above, even for field health benefits. So again, thank you, sir, for the reaction. We will never forget you as Secretary of Health because you were really the one who enhanced hospital facilities all over the country and allowed the country to answer this pandemic in a better way. The second reactor is also, of course, a national gem public health expert and Shed Commissioner, Dr. Lilian De Las Llagas, who gave the opinion and also presented some needs that will have to be highlighted. And this is the comprehensive epidemiology data that was given to us need to be given to the public. She highlighted the fact that data profiling, as she agrees with Sec Icona, should be done. She also presented us, interestingly, some constructs. Gave us the opinion that maybe the elderly, hindi naman nila ayaw. Ayaw ko ba? O natatakot lang ako? Hindi ko siguro ayaw, pero marami akong mga question pa na dapat masagot. And because of the several brands that are available, they want to know, ano ba talagang mas maganda at mas magandang brand for my vaccination? So she actually highlighted the importance of COMB, communication, in order to actually influence behavior, and the importance of risk-benefit analysis, being able to convince them in order that they will take up this vaccination. Marami nga naman mga controversies. For example, whereas our elders were not allowed to go out, now gusto natin silang palabasin for this vaccination. So how do we ensure their safety? So I think that has to be addressed according to her. She also said at bakit di na lang ako magstay at home? Total naman, hindi naman pala ako mapoprotection ng 100% ng vaccination na yan. So that I think she highlighted also needs to be addressed. And of course, the perceived costs of possible complication and even death from the vaccination has to be also addressed. So sabi nga niya, mahal lang mamatay. Mahaba ang linya, mahirap, mainit, may dengue scandal pa tayo before, hindi pa rin ayos yan. So she's highlighting the fact that we need to communicate better. So thank you, ma'am, for highlighting also infodemic. This is really something that we are all grappling with right now. So there was really a great open forum as usual, and we are saying that we are doing well, but we need to focus greater efforts in vaccinating our senior citizens. Even as we ramp up the A4 and the essential workers, we need to also look at our A3, we need to look at our A2, our seniors, and we need the family to be involved. And this family-centered care and effort for vaccination of seniors was also highlighted by Dr. Ted, by Dr. Shelley, and also, of course, agreed upon by Dr. Lilian De Las Llagas and Sec. Icona. So basically, the national ID system was highlighted as a possible way later in the future to make us respond better to pandemics like this and to being able to give a better public health service to our citizenry. So mga lolo at lola, magpabakuna na po kayo. Sana po ay itong webinar natin ay nakatulong sa inyo at yung mga anak naman, kausapin niyo po si lolo at lola, dalhin niyo po sila sa vaccination. I did that for my mother, 95 years old. I brought her to the vaccination site. Pinarada ko yung kotse ko doon, hiningi ko yung syringe, binakunahan ko siya sa loob ng sasakyan para hindi na siya bumaba kasi hirap na hirap din siya bumaba. So mga ganito po ay kailangan natin gawin para sa ating mga mahal na lolo at lola dahil napaka-importante po na mabuhay pa sila ng matagal dahil sila po ay napaka-importante din ang kanilang role dito sa ating society. Hindi ko ma-imagine kung mawawala ang lolo at lola na napakaraming bata dito dahil sila po ay isang haligi ng tahanan. Maraming salamat po.
Okay. Thank you very much. That's Dean Charlotte Chiong of the UP College of Medicine, always giving us a very good summary of a very long discussion, but she's able to do it so concisely. Maraming salamat, Dean Charlotte. All right, next week. Okay, Raymond, you wanted to show the results of the poll?
Okay, just a brief lang po, no? Run through of the results of the assessment poll. So 90% found that the panelists demonstrated thorough knowledge of the topic. Again, 90% found that the panelists were well prepared and organized. 90% also shared that the panelists spoke clearly and audibly. 89% said that the panelists used appropriate language with technical medical jargons adequately explained. And then finally, 90% of the respondents stated that the panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues.
Okay, thank you very much. Thank you, Raymond. So next week, okay, maganda pag-uusapan natin next week. We're going to talk about part 2. Is my LGU prepared for vaccine rollout? Ngayon, secret kung sino yung dalawang mayor na. I hope we're going to get 2 mayors. But remember, last time we had the mayor of Manila and the mayor of Quezon City. We're trying to get 1 or 2 mayors to be with us, and I can't announce yet until I have confirmation. But tuunan natin ng pansin yung LGU. Pag-usapan din ngayon natin yon. We talked about the importance of local governments now. So we're going to try to get 2 representatives from local governments, and we are going to have the UP Pandemic Response Team, UP School of Statistics, show us how the different local governments are performing. So don't forget to be with us next week. Raymond, over to you.
Thank you. So maraming salamat po. Medyo nag-overtime po tayo. Nevertheless, we are very, very happy. Like I mentioned, it's not every day that we get to have a chance to have Commissioner De Las Llagas and former Health Secretary Icona on his birthday. more than anything po, no, to join us in our panel. So magkita-kita po tayo ulit next week, same time from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others laugh before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others laughs before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others laughs before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will hold